My name is Rolanda Aiken. I am a registered nurse with over 25 years of experience. I also have a graduate degree in public health with over 12 years of experience in public health. At Blue Choice Health Plan of South Carolina, my title is Vice President of Health Services. And in that role, I'm responsible for spearheading all of our major initiatives and for our disease management programs at a very high level.
My name is Lena Bretou. I'm a physician and medical director at Blue Choice Health Plan. My formal training is in general preventive medicine and public health. I also have a master's degree in public health. I was trained in South Carolina and have been at Blue Choice and work specifically with health and disease management programs. And I'm at a closer level with regard to spearheading and continue to do outreach within health and disease management programs in the state and the community and for our employer groups.
Diversity, first of all, we have to realize diversity is a very broad term. It refers to differences. It means variety. And when we look at diversity, we consider age, we consider gender, socioeconomic level, geography, whether someone is located in a rural or urban area. We also consider race.
My take on the need for diversity and how it's reflected itself in the need with regard to healthcare is that I think people are realizing more and more that although people may work in the same places, worship in the same places, there are enough differences that are readily evident in things like the disparities that we have in healthcare outcomes between one group and another. So it actually makes it painfully obvious that there are things that we're not addressing, and that's where the diversity actually comes in. You actually have to look at everything from how you deliver that care, how effectively you can communicate those things, and it's not simply based on language per se or ethnicity. It could also be based on age, it could be based on learning styles, it could be based on a lot of different things, whether people like to use their computers for information versus reading, or if they just like to be spoken to out in the community and things like that. The reason we need to address it is because, we've got a lot of costs nationwide and statewide, and even with business owners, cost trends are increasing, and it's for things that are preventable. So we do need to address it, and the way we've been addressing it clearly is not enough. So
I would say the first step is for employers, when they're selecting an insurance plan, to look for an insurance plan that has a diversity program.
Engaging employers and realizing that diversity is something that needs to be addressed is a big challenge, but actually really rewarding once they actually get it. If I can actually get them to understand that everyone they work for, even though they're all working for the common goal of that company, they're all individuals that receive and respond and internalize things about their health differently.
Our goals are driven by the needs of the people. We can sit down in a building and come up with goals, but if they are not addressing the needs of our people, of our members, as well as the people of South Carolina, it's of no use to them. So that's what drives our goals. Our goal is to have more interaction with the people and increase and intensify our outreach efforts.
The goal of reducing disparities amongst different people, whether it's age-related, culture, English as a second language, any of those things for having equivalent outcomes, clinical quality health outcomes, has been a long-term goal. We've actually had that goal for over 20 years. The government has had a 2000 plan to hope to end some of those disparities. That hasn't happened. Then we moved to 2010 to hope to end some of those healthcare disparities. That hasn't happened. But I know that it can happen, and that's what we're pushing for. Because the things that we need to eliminate some of those healthcare disparities, we already have those tools. We just need to engage people in using them. So we just need to engage diverse populations in customized ways that they can embrace to do the things that they need to do to become champions over themselves and champions of their own health. I think we can do it.
I do too.
But that is the end goal.
And get people to realize the importance of diversity.